the membership is only 267. So these are the members. Majority of the members are in Nairobi, but we also allowed other members to join in. With the beauty is that technology has allowed us to do a lot. So through the membership, we, for example, have monthly contributions that go into the kitty to support all these activities. You have a platform that I think has been created by other wonderful Kenyans out there that are, you're able to enroll, and everyone is seeing, every contribution, every money that goes out is seen there. So the members are drawn out of the support groups we have.
Is it only people who are living in the conditions?
Yes, and also caregivers. We also allow caregivers, especially for kids with type 1.
Okay.
Yeah.
How about healthcare professionals?
We have healthcare professionals as well, even within our support groups. And the professions we have also now, we were lucky because all these things, including the facility we have, the medical center, is also run now by professionals like specialists, nutritionists. So they are also, by virtue of being at the facility, they're also members of the groups.
There's something that you'd mentioned, and you talked about your own experience seeing your father going through diabetes and the complications of diabetes, and the impact that had on not just him, but his family as well. Not just you psychologically, but also financially as well. So tell us, what is this that you hear even from the other members? What does diabetes and what does hypertension, what do these two conditions do? What's the effect that they have on the community?
One of the things that we have seen and continuously it's been researched on, you'd require about 7,000 bob on lower side to effectively manage these two conditions, 7,000 a month. So you can imagine the financial toll that this has on families. The other thing is that most of the time the people who are affected by this condition are breadwinners. It's either your mom, your dad, and especially when it's poorly controlled, it would mean that some complications would set in, and which would require that you have to probably be hospitalized most of the time. So there's time that you would lose where you were productive, and you're losing on that income. Whether it also potentially affects your work. The other challenge we have seen, even within the type 1 or type 2, even before people, actually the people who join our groups, they will tell you that especially type 1, they didn't know, that there was such a group, because diabetes can be quite a lonely condition to manage. So these support groups also, it's the platform kind of helps them to understand that it's a whole community. It's not just affecting them. Of course, we have also the other thing that we have seen, and we have also played a great role, is that we have helped the people and even their caregivers to understand how to relate with each other. We always used to kid that a lot of families out there have made because so the financial toll is there, emotional toll is there, and a lot of it, I think, also for us is that when people realize that I'll tell you. So in one of our groups, we have got people like Eli, a gentleman called Eli Udhiamba from UK, and a couple of them have been with the condition for more than 45 years. So it also it gives you a kind of a new thinking that oh, wait a minute, I thought this was a death sentence. Kumbe it's not, because we've got people within this group who are doing things right. So in that way, it also inspires people to be able now to take more care of themselves and change their lifestyles and have a completely different perspective of what they probably used to have before knowing these platforms.
Does the organization have a platform where they talk to people about prevention, understanding that there are things you can do to limit your chances of actually being burdened with this disease?
Yes, and that is, I guess, one of the reasons that that gave birth to what we are today. Because you can imagine, City, from 2014 until to date, all our platforms speak about this condition all the time, and again we do screenings as we are marking World Diabetes Month. We're also doing a lot of screenings throughout Nairobi and some other places.
When you say screening, what do you mean?
The screening, you said medical camp, let me put it that way, where you go out in public, you offer free screening, whether it's random blood sugar, hypertension. So what happens is that you would find there are people who you would screen, and they would find they have elevated sugars. So you're able to give them advice that this is what you need to do. We have a team of nutritionists, clinicians, and a doctor. And also we hold our webinars that we invite our doctors to talk to people whom we invite again from I would say very strong social media platforms, and also to speak about any questions that they would have, including the reversal part or the prevention part.
How expensive is it to manage diabetes, as we're looking at today? Because one of the issues that we talk about is the cost. So looking at folks who are in a community whereby there's support that's being offered, then of course the resources are being shared in terms of where you can go, what you need to do to purchase. Is it expensive to manage diabetes, and what are we looking at then in the treatment of it, whether it's type 2 or whether it's type 1?
It's quite expensive to manage this condition, and I would actually say and ask the people watching or listening, to take preventive kind of, I would say, caution, or rather to have themselves screened, change their lifestyle, because it's very expensive. I'll tell you, even as we mark World Diabetes Day, 14th November, this month, 1921. Is when a gentleman called Frederick Banting and another gentleman called Charles, like you, they invented, quote unquote, insulin, and they passed the patent for insulin for $1. Because insulin was still is for common good, but now when you look at the prices we have, including developed countries like the United States, where even the president had to pass an executive order, to bring down the costs for insulin, it's quite expensive. So you're looking at anything between 500 to 900 shillings for, let me say the most affordable insulin we call Mixtard. But when you now move to other types of insulins, because insulin is categorized into two types, like, fast acting and slow acting. So when you move to the fast acting types of insulins, they would go from anything between, and actually they've gone up right now, really up to around 1,900, 2,000. And you did these pens, like probably one pen would last you a week. So you're talking about 2,000 bob for 4 weeks.
Wow.
Yeah, it's quite expensive.
Siti,
Yes.
when you were working with communities in addressing HIV,
Yes.
you've told us many times before that it was important for, first of all, people to understand the disease, not only those who are infected, but everybody else who's affected as well.
Yes.
To understand it.
The family members.
Family members, the community, to understand it and to know what it is.
Yes.
I'm hearing the same thing that Duncan is doing with his foundation, widening awareness about diabetes and hypertension. I mean, these conditions have been there. I mean, those people just say that and they pass it on and they just assume this person is managing it, or maybe they are not, or whatever they are doing, they are living with it. But there clearly is a gap in the level of understanding of what diabetes and hypertension is.
Well, yes, Eric. Thank you very much for bringing that up. You see, there were two people I worked with. One is called Dr. Jeremy Penn, another one was Dr. Reson Marima. Now, these are some of the most gung-ho, motivated people among people I've ever worked with. But then they had a boss called Professor Elizabeth Bukusi, who was similarly inclined. But being an older person, she was a little more restrained. These two went out of the way to try anything that would work. And we realized that it was not possible for you to tackle this matter of HIV if the entire family of the person who was positive, HIV positive, was not involved. You are not going to manage it, because the greatest enemy to the process of managing the disease was stigma. What people didn't know, the myths around it, the misconceptions around it, as opposed to the truth, because that was what was constantly fighting the truth about it. And involving family, meaning you bring the entire family, they all get tested. And here, entire family means even if you have more than one wife, you bring all of them. Yes, maybe at different times, but they all come. Now, it also meant that you also engage in your employment, the community service. You see this process that you hear the government talking about, community involvement, community workers and so forth. We insisted that the people who worked in the communities had to be HIV positive. There were some who weren't, but the vast majority had to be. And the reason was because when you have people propagating a message, ensuring that the narrative is understood and the HIV positive, it is a lot easier. And if they come from that very community, it helps reduce this process of stigma. Now, why have I gone to town on this explanation? It's because that constant trying to figure a way in which you could reduce not just the incidences, the occurrences and the new infections, but ensuring that people who are then infected could manage it without fear. Now, diabetes, but the HIV, if it wasn't for the interventions and for the treatment and care, it's also a very expensive disease to manage. ARVs are expensive. It just happens that they are donated and they're free, or they're supported, but they are extremely, prohibitively expensive. If diabetes and the management of it had a similar approach, then you would find that the support system, if you're talking about a diet, if your whole family knows, then it's not a problem, because they will know that you can't, there are certain things that you will not be predisposed towards eating. If they are not, they'll keep asking, but why don't you eat this? Or why don't you eat at this time? Why don't you? Now, that alone applies pressure. Now, something that you will also note is that when you have diabetes, the one thing you don't need is stress. You don't need pressure, as we call it. It was the same with HIV. And part of the reason was, to simply put it in layman terms, the advent of stress in your system reduces your immune system. Now, once it starts affecting your immune system, then the likelihood of you being sick or sicker is that much higher. So, yes, it was a process that one went through and one got to understand. And beyond the family, because families are members of communities, it was then easier to involve the community because, yes, families are involved because one of their members is HIV positive. The people who form part of the community service are also HIV positive. So when they are talking or counseling, they have their medication with them. I mean, they will tell you, this is what I take and this is how I take it. Not this is what you should take and this is how it works. All I'm saying is, when you have people with diabetes, I myself am a diabetic. If you have people with diabetes talking about diabetes, then it's a lot easier, because I'll be talking about my lived experience. I don't have to read a book. I'll just have to tell you, this is how it works and this is what I understand it to be. I, for instance, manage my diabetes with a diet. I'm not on insulin. I'm not on any medication. So it's a process and it's a decision that you have to make, and you have to determine, this is how I'm going to go about it.
And there's a case now for these support groups.
There is a huge case for it, because being sick, even if it isn't diabetes, is a problem. Let me be specific, mostly to men. Men usually need to be on their deathbed for them to go to hospital. Everything else, they will simply buy some over-the-counter medication to reduce the pain, to reduce the discomfort. But why the preventative aspect of any disease is important, and this screening that we're talking about, when you know early, you know what to do. Because there's a pre-diabetic stage. There can be signs that you might actually...
Where you're headed.
Yes. Now, once you know where you're headed, then you'll know how to divert it. But you need to be tested. You need to avail yourself. And the tests are not expensive.
CT, I have a question.
Please.
How do we get leaders to openly start talking about, this condition in now as also a way of helping create awareness, because we see it all the time. You know, chances are maybe at the point when someone is passing on is when you'd realize that, the condition that was associated was, diabetes. We have seen it, from, let's say, even the deputy president's brother, all these personalities, whether it's media or whether in politicians, because I think that would really play a great role in helping create awareness. But the question is why and how can we change the narrative?
We still, in this 21st century, are a country where very many people do not believe that people just fall sick. There must be some elements, some forces, some people behind the sickness. So again, an admission of illness is considered to be a catastrophic admission. It's like hoya, kwani. Stigma, as we recall it, plays a very, very key role in very many things. You're asking the question, how do we get people to be able to understand that being sick isn't a weakness? Being sick is not a sign of you having done some wrong that is following your family somewhere along the line. Being sick doesn't mean you're not able to do what you're... You see, there are many things that one needs to understand. So it's not something that is going to be achieved in a day. Like what you and the association that you work with are involved in, there's a lot of progress that has been made, but it wasn't done in a day.
Sure.
It's something that you keep at it now, because that's how life as a human being on this planet is. A lot of the things we do are repetitive. A lot of the things we do bring about change, but it's incrementally, it's slow, and it's hardly noticeable. One talks about the noticeable stage when a lot has taken place and you're seeing the eventual results.
One of the researchers mentioned that, especially in the government, in also doing more to screen, because, you could even make it part of the process, whether you're visiting the public health hospitals and all that. But, one guy mentioned that the government is a bit hesitant, because they would screen, and of course they would realize that there are many people, living with this condition. Then, what happens?
They have to think of management.
Yes, exactly. And you must think of... You see, the thing is this, research science has indicated with great clarity, because if you're talking about even the deaths caused by diabetes in the developed world has done a lot of work. The understanding about diabetes, it's out there, people know, okay? And what to do to be able to lower the chances that the likelihoods of it exists. How to prevent it, what to do exists. Point is, if we talk about just two things, lifestyle, diet, that's it. We're not talking medication. We're talking about things which are within the purview of most of us. What do you do with your lifestyle? What do you do with what you eat? I mean, what do you eat? Now, as you correctly put it, most of the foods that we consider traditional foods, they were at the heart of the preventative activity you could take. Just traditional foods, what we call traditional foods. This brown porridge, this brown ugali, which you look at and you wonder whether it's also staring back at you.
This was part of it.
Yes. And then, remember, in a traditional living, your life was full of activity. You woke up in the morning, there was something you were doing physically.
Yeah.
Okay? You were always doing something physically. When you went to visit, you were walking. Here we sit the whole day, then I go to the gym. Then come back the following day, sit the whole day, go back to the gym. Okay? I eat a hamburger until it's coming out of my ears, and then I go to the gym. Now, you see, I'm simply saying, most of what is needed is within our purview.